Hey everybody, I'm Molly Reed. I'm with Who We Play For, and we are so excited to start this weekly video project and series where we're going to be talking to people we find inspirational. We hope you will find inspirational, so everybody can learn a little something while scrolling through their social media. We're going to be talking to people who are doctors or other people in the medical field. We're going to be talking to athletes, different people who all have a story. So, the first person we're going to be talking to is one of our fabulous board members, Dr. Gul Dadlani. He is with Nemour's hospital, and we're talking to him about everything in the world that revolves around cardiology and heart screenings, and just why it's so important to look out for your heart health. So again, this is going to be a kind of an interview style, this one, but sometimes we're going to be doing some talk show kind of style ones too. So we're really excited about this. It's all over Zoom, this one, because we're still in the middle of a pandemic and stuff. So brace us with us, as we go through that little challenge with the technology and stuff. But we're really excited. We hope you learned something, so here we go. Why weren't, you think, heart screenings a mandatory thing during physicals for so long, when it seems like sudden cardiac, it is a big issue in student athletes?
Sure. Some of the barriers to doing EKG screening across the country have, number one, been cost. Number two, been the resources it takes for a school district or a healthcare system to lay a program out like this. We all know that EKGs can screen and catch many forms of cardiovascular disease. They do not catch all forms of cardiovascular disease. So when to screen, how to screen have all been issues that have been raised by groups throughout the United States, and have limited EKG mandates, nationally for sports participation. When you look at Who We Play For and how they've approached this, I think they've answered many of those questions. So they do low-cost EKG screening. They come in with a volunteer group and perform EKGs at schools in mass settings so that they can be done effectively. At the counties that they have policy-related procedure, have policies for EKGs prior to sports participation. They have multiple opportunities for students at each high school to be able to receive EKGs within their community. Every family still has the opportunity to go to their primary care physician or other provider of their choice with that. And I think they've also looked at how do you follow up on these patients as well. So they've worked with nonprofit groups for those who are unfunded to ensure that they also have follow-up care available within their local communities. And I think that goes a long way to not only doing the EKG, but how do you take care of cardiovascular disease once you have found it within a local community. And I think it's really a model to look at, for the future, both on a statewide level and or a national level, is, how can you roll out mass EKG screenings? And they've really answered many of the questions that, have limited these programs elsewhere.
So for people who may not know, just what, we know, obviously, like it's usually an underlying heart disease that leads to sudden cardiac arrest. The people, it's really only detectable through an EKG or ECG. So, we advertise that. That's why we do what we do all the time, is to try to stop that from happening. But when it comes down to the nitty-gritty of these heart diseases, I mean, are these things that are like hereditary? Are they genetic? How do they form? I mean, is it just something that happens, or how do people, I guess, understand that portion of it?
Sure, great question, Molly. When you look at a sudden cardiac arrest in athletes, the most common cause is a condition called hypertrophic cardiomyopathy. And 1 in 500 people will carry a gene for this. So this is passed down from mom or dad. And there would be a 50% chance, if your mother or father had this, of you having this disease process. And it is more frequent than is detected, in the community. So by performing EKG screening on adolescents, you can pick up hypertrophic cardiomyopathy with that, and be able to identify these patients before they have a sudden event. on the field or during a practice or outside, even just at home with that.
Yeah. I mean, it is scary. I mean, it's like the whole thing can just be scary. And I think that's why it's, we try to do what we do. But I mean, how often, I guess, do you see patients or parents who just had no idea maybe that, this was something that is affecting their child or the teenager or something like that, and it ends up being a pretty big deal and something that they need to correct?
Yeah, unfortunately, that happens more frequently than we want. So many times families have no idea that they are a gene carrier for either hypertrophic cardiomyopathy or an arrhythmia. And then their first symptom is a sudden cardiac arrest. And that leads to a lot of anxiety, both for the family and within the community when sudden cardiac arrest happens.
And how, I guess, so when you guys are doing, I guess if you want to explain your process from like the Who We Play For screening side, I guess from where we do it, we do the heart screening and then it all just gets delivered back to you and then you kind of read over it, or why don't you explain what your kind of role is too?
And so, the way that Who We Play For does screenings, they have volunteer screeners in the community that go out to schools to do mass screenings. They'll do anywhere from 1 to 500 within a day. And those screenings then come electronically back to a cardiologist to be read. And those would get read and then either diagnosed as either normal or abnormal. And then the results get sent back to the family by Who We Play For. And a copy also goes to the school district so that school knows which patients had abnormal findings.
Yeah. Do you think it's an efficient system? I mean, how do you think that, I guess, not just Who We Play For, but how do you think the entire, just way of how we read our hearts and stuff like that, how do you think that all could be improved possibly?
Well, I think Who We Play For has a great model for doing mass EKG screening, both here locally in Florida and beyond. And, I think the time turnaround is appropriate for patients and families so that student athletes can get back to the field as quickly as possible. Because obviously every student wants to play their sport, tomorrow. And as they come in for their sports screening physicals, practitioners want to ensure that every child is as safe as possible. A traditional physical exam and 14-point American Heart History does a good job of screening many patients, but adding an EKG to that screening enhances the detection rates for hypertrophic cardiomyopathy and some forms of inheritable arrhythmias to try to prevent students from having a sudden cardiovascular event while participating in athletics.
Oh, yeah. Well, okay, I think that's good. Our last question really for you today is, as we've told you we want to start asking people more, is who do you play for? It's, we all have a reason that we're out there fighting the fight, doing the good work and stuff like that. So I guess, what is your reason? Why did you, want to get into cardiology? What made you passionate about it? And then, who do you play for, I guess, at the end of the day?
Sure. So I'm a pediatric cardiologist. I've worked in pediatric cardiology for the last 15 years. And I became a pediatric cardiologist coming out of medical school because I had a sister that was born in 1980 with a form of congenital heart disease called an AV canal. She had surgery for that and was able to go to school and participate in sports and get married, have children, and lead a very normal life. So I always found it amazing that you could take a child that was born with a severe abnormality within their heart, give them appropriate care, and they could go on and lead a normal life. And so I went into pediatric cardiology so that I could hopefully give that back to other families that have children born with congenital heart disease. and other forms of cardiovascular disease, because approximately 1 in 100 children are afflicted with some form of congenital heart disease at the time of birth, and our goal is to make sure all of them make it to adulthood and have a great quality of life.
Again, that was Dr. Gul Dadlani with Nemour's Hospital, our fabulous board member. So we thank you for watching, and we will be back next week with another video where we'll be talking to an athlete who's actually gone through a lot of these challenges himself, and we're really excited about that one too. It's going to be more kind of like talk showy style. We just, changing things up a little bit. We just want to bring a little positivity, give you guys something to think about as you go upon your day-to-day life. So thanks again for watching, and we hope to see you next week.